Hello, welcome to Trafalgar Addiction Treatment Center webinar series. Today we're going to talk about marijuana, the good, the bad, and the saving grace. We offer a residential and outpatient rehabilitation treatment program for addiction and co-occurring mental health problems. Our highly trained and experienced team of professionals are ready to provide customer therapeutic addiction treatment for the abuse of substances or processes, as well as mental health issues. I'm Dr. Christine Courbasson, your host for today. I'm a registered psychologist with the College of Psychologists of Ontario, with years of experience assessing and treating physician, veteran, and other first responders, and I'm involved in the training of clinicians in the assessment and treatment for mental health and addiction problems. Today we're going to talk about the history and the use of marijuana, its reason for using it, and a short and long-term effects. We will be talking about the various types of uses, and the factual and misperceived benefit and danger of marijuana use. We will also cover some addiction and treatment options to consider for people who have problems with this substance. Marijuana or cannabis is a greenish-grayish mixture of dried flowers of Cannabis sativa. People also call it weed, herb, pod, grass, bud, ganja, Mary Jane, and other names. Let's look at the history now. This plant was cultivated by humans for thousands of years. It is likely that it originated in a Central Asian steppe near the Altai or Tian Shan mountains, and it was first cultivated in China and India. The primary cultivation was for fiber, medicine, clothes, paper, and food. If you look at the earliest writing, in 2700 BC, the ancient emperor Shen Yun, who is also called the father of Chinese medicine, was looking for plants for cures. He was a good farmer, and he was concerned about his subjects who were suffering. So this plant at that time was used to manage rheumatism and malaria. And it was found that the female plant produced much more medicine. In 2350 BC, there was an ancient poetry that you could read where it talked about young girl weaving hemp into clothing. Around 1122 to 249 BC, there are reports of fragments of hemp cloth in Chinese burial chambers from the Chu dynasty. There were also rope imprints dating from about 10,000 BC that were found on broken Chinese pottery. The Chinese archer made bowstrings from hemp because they found it was much stronger and much more durable than the old bamboo ones. And the Chinese people found that the arrow could fly much further when they used the bowstring made of hemp. There are reports of 1st century BC fragment of paper containing hemp fiber in Chinese grave. Now more with the medicine, we know of cannabis tincture that was prescribed by the physician of the Queen Victoria for a menstrual cramp. And there are various reports of cannabis use in the 19th century medicine. So marijuana is basically the slang for portion of the cannabis plant. There are three major species. The first one is Cannabis sativa, the other one Cannabis indica, and the third one Cannabis ruderalis. The main psychoactive substance is the THC that's found in the resin that's produced by the leaves and the buds, primarily from the female cannabis plant. Let's take a look at the three major species in a little bit more detail. The sativa has a high THC and low CBD. It tends to create more euphoria and a head focus high. In a small dose, it can boost energy level, focus, creativity, and divergent thinking. It also helps with anxiety and stress reduction. However, at higher dose, it can actually bring anxiety. This species is typically not the first choice for medical market, except for specific conditions such as ADHD, depression, and social anxiety. It has a fruity and spicy flavor, and it's usually used in recreational food and drink market. The indica species has a lower THC and a higher CBD. It tends to bring body-centric effect to soothe the muscle, the aches and pain that people have. It will increase appetite in people who have issues with appetite, and it can help bring sleep in people who have insomnia. It also helps with social anxiety. The ruderalis species has a low THC, a higher CBD compound. It tends to produce a more calming effect. It's the relaxing effect without the high. And it's often used to treat anxiety and insomnia without the high. It's used in medicinal market a lot for neuropathic pain, fibromyalgia, and rheumatoid arthritis, although it is used for other conditions. This species has more of a fibrous stems, and it tends to be used for clothing and textile too. People were used to grow those plants on their properties, in their backyard, but with the war on drugs, the growers have been forced to move all those plants inside. So there has been a lot of genetic experimentation to try to maintain the strains. People have mixed different strains of indica and sativa, and there is a lot of hybrid out there. What also is noteworthy is that over the years, there's been a steady increase of the amount of THC that's contained in these plants. Cannabis is a diverse plant. There are literally thousands of different strains, dozens of categories, and several different species each. There are different subspecies with unique characteristics. A lot of subspecies for medical market and some for the commercial sectors, such as agriculture and textiles. Let's take a look at the cannabis use. So how do people use it? Well, they may hand roll it in cigarettes that they call joint. They may smoking in pipes, water pipe. They often call that bongs. They may roll it in cigar wraps, which they call blunts. They may take it as a tea. They may mix it with food. which people call edible. They may use a vaporizer or e-cigarette pen. They may take it as a tincture or in oils, cream and lotions or patches, or in beer and coffee. So why do people use cannabis? Well, there are many reasons. Some people think that it is expected. For some of them, they see it as just an opportunity and they may just try it. Some of them are just doing what people around them are doing. Children of people who smoke cannabis are at home and they see it as a regular activity will tend to smoke it too. Some people will use it to manage social contact. Some people prefer to use it to relax, others to concentrate. Some people, it's to increase the sensation that they have or increase creativities. For others, just avoidance. They want to avoid some of the stress they are encountering and they will smoke to focus on something else. There is a low perception of harm, so people have often thought that cannabis is not dangerous, so they will smoke it here and there. Some people cope. Some people smoke it as a curiosity. For some, they feel that other pressure them to smoke with them too. Some users use it for spiritual component as part of gathering of spiritual experience. And many will also use it for medical reasons. So what are the short-term effects of cannabis use? Well, there is the high, and then people talk about dry eyes or the dry mouth. Some people feel drowsy. For some people, they report an increased appetite. They eat more or they talk about having the munchie. But these tend to be a dose specific. Other short-term effects are the vision is different. They see things in brighter color. People are more relaxed. Some people have a different sense of time. In terms of short-term effect, we also notice changes in people's mood. Some people can experience anxiety and panic. Their movement and coordination may be impaired. They have problem thinking. They have problem resolving solutions. And the reaction time tends to be lower. People complain about their problems with memory with short-term use. We see an increased risk of motor vehicle crashes. There's paranoia. In higher doses, people will experience hallucination as well as delusions and also psychosis. The highest risk for psychosis tends to be when people use it regularly at a high potency. Males tend to report sexual problems, and there are research that shows that nearly 5 times usual risk of heart attack during the first hour after smoking marijuana. There is a head rush or dizziness on standing up, and the heart rate will increase, and sometimes it increases by 20 to 50 beats per minute. It doubles in some cases. And that might be explain the heart attack frequency. And what are the long-term effects of cannabis use? Well, there are many long-term effects. People have breathing difficulty, they may have bronchitis, they experience a low life satisfactions, their thinking, their memory, and their learning is impaired. There are changes in how the brain builds connection between different functions. People who were heavy smokers while they were teenagers and who experience an ongoing marijuana use disorder tend to have an 8 IQ point loss between the age of 13 and 38. What research shows that actually the mental ability didn't fully return even after they quit marijuana as adults. Some people experience hallucination, paranoia. People with schizophrenia have a worsening of the symptoms. There are mixed findings about whether long-term use of cannabis brings depression and anxiety. At the same time, we know it does bring relationship problems. And marijuana use in adolescents has been found linked to an increased risk of aggressive form of testicular cancer. There is also the recurrent bouts of severe nausea, vomiting, and dehydration that people experience. People tend to be in a poorer mental and physical health. And now there are various reports of death related to vaping. People who smoke when they are young or people who use marijuana from various forms as a youth tend to have less academic and career success later on. They may then experience dependence on cannabis, experience financial problems, and we know that they have more difficulties at work and at school. Like if it's not enough, there's more bad coming. Cannabis withdrawal is real. People will experience craving, they will be agitated, they can't sleep, they can't eat without the cannabis, they have anxiety, depressions, they have mood changes, they are more irritable and some engage in aggression. They complain of headache, sweating, shakiness, anger. They're tired during the day, they're restless, they complain of stomach pain. They may lose their appetite altogether and lose weight. They feel nauseous, they can't sleep. They may even experience fever, chill, and strange or wild dreams. Let's take a look at the treatment for cannabis problems. Some people will require detoxification. It is usually done on an outpatient setting, and it can last from a few days to 3 weeks, depending on the issues associated with the cannabis. Residential treatment is typically needed for moderate to severe dependence, people who have low psychosocial functioning, or people who have moderate to severe psychiatric comorbidities. There's a need for supportive psychosocial intervention, psychoeducation, and non-pharmacological symptom management. Usually occupational and exercise therapy tend to be part of the treatment. And there is medical and psychiatric diagnosis and treatment for the comorbid condition as needed. The duration vary. It tends to be related to the severity of the comorbidity or the cannabis use disorder. It can take several weeks. There has been some outpatient or laboratory pilot trials with lithium, antidepressant, anticonvulsant, glutamate modulator, and mucolytic agents, muscle relaxants, baclofen, anxiolytic, antipsychotic, and CB receptor agonists. So there's quite a bit of trial that have been conducted. So the result of those trials have not always been great, and there has been no relevant or worsened effect on the cannabis withdrawal symptoms with antidepressants and variant ones. Viloxazine has shown to aggravate the withdrawal symptoms, and some people went as far as saying that it actually contributes to the smoking of cannabis. Quetiapine has been found to improve appetite and sleep quality during the withdrawal symptoms, but then it worsened the craving and led to cannabis use. In one research, there has been some decrease of cannabis use within 8 weeks of treatment of quetiapine, and there's been some improvement seen in terms of the withdrawal symptoms from cannabis with gabapentin. So other reducing of cannabis withdrawal symptom has also been found with some THC analogs. So now the saving grace. Yes, there is treatment for cannabis use disorder or any cannabis problem, and treatment is typically effective. It's important to provide individual therapy. Group treatment can also be very useful. What is critical is to address the reason to use and also develop refusal skills. Family counseling can be helpful because family is often affected. Providing structure is critical, and it's usually best to transition from a structured program, residential program, to a less structured environment, but reduce the structure slowly and help the individual build structure in their life. And of course, aftercare is very important. So, looking at various research, there is some evidence that cannabis can be effective to reduce anxiety. It can reduce inflammation and relieve pain. It also has been effective in controlling nausea and vomiting caused by chemotherapy. And there is some preliminary evidence that it can kill cancer cells and slow tumor growth. It will help relax tight muscle in people who have MS. And it can stimulate appetite and improve weight gain in people with cancer and AIDS who have difficulty with feeding. It's also been used quite a bit to control seizures disorders. Yes, cannabis can help people cope with certain ailments. At the same time, it is definitely not harmless. People must use it with caution if they choose to use it. For those who got in trouble with it, there is treatment available. If you want to read more about it, there is a list of links that you may want to try.